Hello doctors. Today let's talk about the coronary arteries. We all know that the heart supplies blood to all the organs in the body and all the tissues. But these coronary arteries are the vessels that supply blood to the heart. So, whenever there is a block in these coronary arteries, there is loss of blood supply to a part of the heart which is called as myocardial infarction. Now, let's jump into the topic. Let's see how these coronary arteries are kept in the heart. Now, this is a heart. This part is the aortic sinus, from where the coronary arteries arise. You can see there is a right coronary artery and a left coronary artery. Now, these right coronary arteries gives many branches as well as the left coronary artery. Now, let's dissect these blood vessels virtually. If you see in a heart, there is a right atrium and a right ventricle. There is a left atrium and a left ventricle. In the right atrium, there is right auricle. In the left atrium, there is left auricle. The pulmonary trunk arises from the right ventricle. The aorta arises from the left ventricle. Just now we saw where was the aortic sinus. From the aortic sinus there are two arteries, that is right coronary artery and the left coronary artery. Let's see the course of the right and the left coronary arteries. For the right coronary arteries, it runs between the right auricle and the pulmonary trunk, and then it descends down at the atrioventricular septum, that is between the atrium and the ventricle. Atrioventricular septum. Then the right coronary arteries curls and goes behind the right ventricle. That's why it is in the dotted lines. The right coronary artery comes from aortic sinus, goes between right auricle and the pulmonary trunk, then descends down between the right atrium and the right ventricle, called as the atrioventricular groove, and curls and goes behind the right ventricle. The right coronary artery has many branches. Let's see the first branch. First branch is right conus artery. Right conus artery supplies the pulmonary conus, which is infundibulum of right ventricle. This is the pulmonary conus, and it also supplies a part of the upper part of the right ventricle. The next next branch of the right coronary artery is the SA nodal artery, supplying the SA node. The SA nodal artery also has small branches supplying the right atrium and the left atrium. Now, next branch is acute marginal artery. The acute marginal artery is a branch of right coronary artery supplying the lateral surface of the right ventricle and the apex. This is the apex of the heart. Now, if you see, the right coronary artery is posterior to the right ventricle. There, it gives a branch. That branch goes between the two ventricles, that is between the right ventricle and the left ventricle. This area is called as interventricular septum, that is between the two ventricles, that is the interventricular septum. This artery is called as posterior interventricular artery. This posterior interventricular artery supplies the posterior 1/3 of the interventricular septum. Because it is in the dotted lines, it means that it is in the posterior side. Now, this posterior interventricular artery also supplies some part of the right ventricle and some part of the left ventricle. This posterior interventricular artery gives a special branch called as septal branch. This septal branch supplies the AV node. We all know that the AV node is situated between the right ventricle and the left ventricle. Here. So this posterior interventricular artery will give a branch to the AV node. Now that's about the right coronary artery. Now let's see about the left coronary artery. The left coronary artery runs from the aortic sinus. It goes by between the left auricle and the pulmonary trunk. The left coronary artery then descends down in the atrioventricular septum, just like the right coronary artery. Atrioventricular septum between the atrium and the ventricle. Then it just curls around and goes behind the left ventricle. This part is given a separate name, and I will let you know in a minute. It goes behind the left ventricle and anastomoses with the right coronary artery. This artery is called as circumflex artery. This circumflex artery supplies the lateral part of the left ventricle and also the posterior part of the left ventricle. Now there is another artery from the left coronary artery. This artery runs down from the left coronary artery in the anterior part of the left ventricle, that is in front of the left ventricle. This artery runs down directly to the interventricular septum, that is between the two ventricles, and anastomoses with the posterior interventricular artery. This artery is called as anterior interventricular artery, that is, it is running anterior to the left ventricle and interventricular between the two ventricles. It is also called as left anterior descending artery. This artery is also given a special name called as the widowmaker's artery, because most of the myocardial infarction cases, the atherosclerosis or the thrombus is seen in this artery. So that is why it is called as the widowmaker's artery. Now, this anterior interventricular artery supplies the anterior 2/3 of the interventricular septum and also anterior side of the right ventricle and the left ventricle. There is another branch of the left coronary artery called as the obtuse marginal artery. Beware guys, acute marginal artery is a branch of right coronary artery, while obtuse marginal artery is a branch of left coronary artery. This obtuse marginal artery supplies lateral part of the left ventricle and the apex. Now let's see what does the right coronary artery and left coronary artery supply. The right coronary artery supplies the right atrium, the right ventricle, the posterior 1/3 of the interventricular septum, that was by posterior interventricular artery. Then small part of the left atrium, SA node, AV node, bundle of His, and left bundle branch. The left coronary artery supplies left atrium, left ventricle, part of right ventricle, anterior 2/3 of the interventricular septum, that was by anterior interventricular artery, right bundle branch and the left bundle branch. Now let's see the venous drainage of the heart. The venous drainage of the heart, the main person here is this coronary sinus. The coronary sinus has tributaries from all over the heart and it drains into the right atrium. Now let's draw it virtually. Let's see the venous drainage of the heart. This is the right atrium. This is the anterior part of right atrium, posterior part of the right atrium. From the posterior part of right atrium, there is this coronary sinus. This coronary sinus gets blood from all over the heart and drains into the right atrium, just like the superior vena cava draining from the upper half of the body and inferior vena cava draining from the lower half. Now let's see the tributaries of the coronary sinus. Whenever the coronary artery supplies tissue of the heart, the deoxygenated blood from the tissues is given back to the veins, and those veins drains into the coronary sinus. Now there are specific veins for specific arteries. The circumflex artery and the anterior interventricular artery gives oxygenation to certain tissues in the heart, and those tissues are drained by great cardiac vein to the coronary sinus. So circumflex artery and anterior interventricular artery are drained by the great cardiac vein. Just like this, the posterior interventricular artery is drained into the coronary sinus by the middle cardiac vein, and the acute marginal artery is drained to the coronary sinus by marginal vein. This marginal vein turns out to become small cardiac vein, which goes to the coronary sinus. The right conus artery and the SA nodal artery, both of these drain to the small cardiac vein and then go to the coronary sinus. All these are the tributaries of the coronary sinus. Now there is a special mentioned artery here. That artery is not a part of the coronary sinus. That is the anterior cardiac vein. The anterior cardiac vein drains part of the right ventricle into the right atrium. This drains in the anterior part of the right atrium. The anterior cardiac vein goes to the anterior part of the right atrium. It is not a part of the coronary sinus. So this is an important point. Thank you, doctors.